Statistics from the Ministry of Health indicate that more women are embracing modern family planning commodities in the country. Health Principal Secretary Susan Mochache says this year alone, 6.3 million women have reported using modern contraception, averting some 2.4 million unintended pregnancies. Modern family planning commodities are, however, still a hard sell in arid areas as women opt for traditional methods of birth control.
On Monday, the Ministry of Health and Development partners signed a memorandum of understanding on establishment and implementation of a sustainable financing mechanism for procurement of family planning commodities. The arrangement is set to enhance access of family planning commodities to a tune of 2 billion shillings. According to the Principal Secretary in the Ministry of Health, Susan Mochache, this year alone, 6.3 million women used modern contraception, a situation that averted 2.4 million unintended pregnancies.
When you think about it and contextualize that it is the lives of women, it is not just numbers, it's somebody, a woman somewhere who was desperate and this contraceptive saved them, then you realize that that number, 2.4, is not little. There are families who could have become even much more poorer and even suffered nutrition because of an unintended pregnancy. 2.4 million families perhaps saved from that tragedy.
Repeated surveys done over, especially by performance monitoring for action, which shows that the total fertility rate has declined from a high of 4.6 to currently 3.9. And significantly also the unmet need for family planning has declined to stand at 18%. And over the implementation period of this program, we expect that this will come down further to 9%.
However, despite the steps made so far in the uptake of modern contraception, the Ministry of Health is still concerned over disparity in arid counties.
Counties, especially northern arid land counties, where family planning uptake is still very low, the modern contraceptive prevalence rate is still very low, and we need to do a lot of advocacy even as we assure commodity security by working with the communities through social behavior change communication to increase the uptake of family planning.
But you can't have that conversation without talking about counties playing their role, with about health workers playing their role, and with actually communities and women and also men in communities, just making this having that full effort from everybody involved. That's the way you have success.
USAID remains committed to advancing access to voluntary family planning services in Kenya. This is key to meet the pledge of the 2030 agenda for sustainable development to ensure universal access to sexual and reproductive health care services.
The Director General in the Ministry of Health, Dr. Patrick Amoth, underscoring the need for counties to be actively involved in dissemination of information towards ensuring social behavior change. Nancy Okware, Lunchtime News.